about this is a school clinic manager and director of family health at Lead Nurse Africa International Foundation, Julie Ngobu. Good morning. It's nice to have you join us, Julie.
Good morning. Pleasure to be here.
Very good. Yeah. Now, Nigerians are saying that as a way of taking precaution, as a way of also being ahead in preparation, that schools should be closed because of coronavirus.
Well, maybe we'll begin from the awareness created. I think people are taking their minds back to the season of Ebola, that when we had that breakout, that students were asked not to resume and were asked to stay back at home. So I think they're expecting the same thing to happen this time around. But I think there's a need to look at the level of awareness created, which has significantly improved. And of even social media, people are spreading less of the fear virus, and they are spreading facts. People are sending messages around. So the awareness is impressive. It has increased. Then if we check the numbers of those that are affected, the confirmed cases and the death tolls, we could see that it is more in the Asian part of the world and lesser in Africa. And if we decide to play by the rules of personal hygiene, I think we'll just be fine. I do not think we should be in a hurry to shut down schools. I know, I think Iran, China, and even Italy, they've shut down schools, but I do not think that that is what we should be bothering ourselves about.
At what point should we be looking at, because we spoke to someone yesterday and he said that we haven't gotten to that point where we'll be talking about shutting down schools. But at what point would we begin to take this kind of precautionary measures? Because we are looking at containment. Yes, we have an index case, but then if we want to go a step ahead, like he mentioned, at what point would we be looking at this?
I think we're trusting not to have, if we do the needful, which is the opportunity that coronavirus, the opportunities that this brings to us, and one of it is spreading the gospel of personal hygiene. And it's not just to take care of or to prevent us from contracting this infection. It takes care of a whole lot of illnesses as well. So let's use this opportunity and spread the gospel of washing of hands, as simple as it is. Let's focus on what we can do, because just as coronavirus is killing people, we have cancer, we have diabetes, we have hypertension, many people are going down. Malaria. So we should not just localize it and think that, okay, the demon we're chasing or the problem we're facing here is just coronavirus. There's so many others. So let's use this opportunity, channel all our resources and our energies, get the schools to have sanitizers. With what is happening, I do not know how well we'll be able to manage this if they're increasing the prices of sanitizers and the face mask. So let's focus on spreading or distributing free hand sanitizers, then get the schools to have running water, to have soaps to wash their hands, get health workers to move into the schools to start educating people, ask families, religious organizations, let them go about spreading the gospel of personal hygiene.
All right. It's interesting you talk about free hand sanitizers when the prices have gone off the roof. Well, thank you very much, Julie Ngobu, for coming on.
My pleasure.
Thank you. Right. Our guest is a school clinic manager and director of family health at Lead Nurse Africa International Foundation, Julie Ngobu. Julie, good to see you.
You're welcome.
Thank you.
If you see one of the reports we played earlier on where the Commissioner of Health, Lagos State, was talking about the fact that when it comes to contact tracing, there are about over 30 people who gave fake information about who they are, what they are, and how, and they can't be traced, but somehow they are within, you know, within the neighborhood, or they've traveled to other parts of the country. Just how scary is that when you stand and look at Lagos or look at Nigeria and see any of those could be anywhere?
Yes, it's quite scary, to be honest, because you cannot tell if the person next to you was on that flight.
Exactly.
One of the over 30 people being
or the spouse of somebody on that flight, or the child of somebody on that flight.
They belong to a family, so they would have gone back and had contact with their people. So it's actually quite scary. The more reason everyone should be a brother's keeper. So it's important if you identify anyone, like the report that had the woman from that company in Ogun State that was coughing and went on, she is just like, submitting myself. I just want to be checked. That should be the attitude that everyone should adopt. You have someone that is exhibiting any kind of contact symptoms, encourage that person. Why
But
not
people are
go-
scared of stigmatization. That has always been a challenge with any kind of situation that we find around ourselves.
Let's check. I know stigmatization will not stop. So long as we have life and we'll always have epidemics, that will not stop. But we have to check the other disadvantage. If you do not go to check, you will not have proper treatment and you have the chances of transmitting or infecting other people
which is
around
worse.
you. You're not going to stop working. And if at any point in time people discover, oh, so you were sick and you went on going, that thing you're running away from, you're still going to
back to
face
you.
it. And it may even be worse. So I think we should go beyond living for ourselves and think we understand that stigmatization is not something anybody wants to go through. But let's begin to think about other people. Let's begin to think about the effects. Let's begin to think, it's a ripple effect. If we have those considerations, we would want to just submit ourselves for proper care. We've always said in most of the infectious illnesses and even non-infectious illnesses is going to be better managed when there's earlier detection and earlier beginning when you start treatment on time. So if you sense any kind of illness, just report yourself to the hospital. The same thing goes for cancer. The same thing goes for kidney problem, hypertension. Once you identify something, just go to the hospital for check. I usually would say, know the demon you're chasing. Find out first. So you know the weapons that you have to carry in order to fight. Yes.
Very
So you know if the demon has two horns.
Two horns, you know you have to carry a double-edged
just only
sword or
one
something.
horn.
Yes.
Okay. Well, the point there is we're focusing on the children and schools right now.
Yes.
Some people have said that if Nigeria goes closing schools right now, it's going to send more panic than it is right now.
I totally agree. It will send more panic and it's going to spread the fear faster. Oh, schools have been shut down.
Right.
Oh, it's a serious thing. It's more serious than we thought. But like I said earlier, let us check the numbers. What are the categories of people that are infected? How old was this index person who came in? I heard he was about 80 years old, or he is about 80 years old. And if you check
No, he's
statistics,
not
No,
80.
so that's-
that was
Just-
ahead,
yeah.
really. So he said the statistics says that
44
those that 44,
Yeah.
some figures there. So those that are prone or susceptible to these illness are those of older age category. Then so far, as at this morning that I checked, 0 to 9 years old, there have been no fatalities recorded. And the chances of them contracting this virus, it's actually 0.2%. And same goes to, I think, about 39 years old. So if you send the children home, how about those that will have to be checked and looked after by grandma and grandpa that are more susceptible to coronavirus? So that too also has to be checked. Like I said, it's important to look at the opportunities this brings to us. And what is the opportunity? Sample the opinion of the average person out there, the market woman, the truck pusher and all that. Do they adopt personal hygiene?
Hygiene.
All right.
Hygiene. All
Thank
right.
you so much, Julie Mogbo, for
Julie.
speaking with us.
Thank
Well, our guest is a school clinic manager and director of family health at Lidnos Africa International Foundation, Julie Mogbo. Thank you for joining us.
My
TVC
pleasure.
Breakfast.
Good morning, Julie. Nice to see you.
Yes, nice
All right,
to see you.
attention is on schools and the likes, but if I may throw the question directly, what can schools do at this point, taking precautionary measures?
The first thing the school should do is to ensure that they have the basic equipment or materials in place. At the point of entry, there could be a notice outside assuring parents and caregivers and the students that the school is putting in place or has put in place certain measures to ensure that the children are safe. So that alone would allay some fear and anxiety. So it just gives this good feeling that my kids are safe. When I before I even step into the gate, I've seen a sign on the gate. That's one thing schools can do. Then either at the gate or just immediately they get into the gate, there should be some bucket, basin, running water, equipment, and then there should be a soap and the tissue pack, not the hand towel, because you can't share that. So you have the tissue to dry the hands and the waste bin so that can be passed in, and someone should be put in place. Now, sometimes some schools, in order to cut costs, they might water down the hand
soap,
wash, the
yeah.
soap. So at some point there might not be soap there, but let them have someone that if if someone handles it and drops a little bit and directs the children, wash your hands. And don't be scared of asking any parent to do the same thing. If you're coming into the school, please wash your hands. You have someone that will speak to the parents and any guests respectfully, then you have the tissue pack there. That's another one. Then allay the fears and anxiety of the children and the staff by educating them, creating the awareness that is not a death sentence. Let them be assured that so long as you wash your hands thoroughly now and then, and if I have the time, I'll do a song. So there's a song that...
fine, you can do it.
Okay, so now this is something that students, teachers or schools can adopt. So wash your hands every day to keep germs away. Wash with soap and clean water to be healthy always. Wash your hands every day to keep germs away. Wash with soap and clean water to be healthy always.
Oh, I feel like a music director right now.
So it could be fun for the children.
Right.
So they would love that. You do that in a school every now and then. Do that before they go to eat, after they use the bathroom, before they... That can be done in school. Then they get home, they pass it on. So parents are learning as well. It creates bonding opportunity for children. And when learning is done in a place, an atmosphere of fun, it sticks.
Definitely.
It sticks.
Okay,
Definitely.
I think we all have to learn that song. Every day
to keep germs away. Wash with soap and clean water to be healthy always.
Thank you so much. Thank you.
That's nice. Thank you so much, Julie, for the song and the time.
My pleasure.